For Insider Medicine in Depth, this is Dr. Davin Johnson. Using epinephrine to help restore circulation among patients who have experienced sudden cardiac arrest outside of a hospital setting may not be warranted, since it may reduce the likelihood of surviving with all organ systems intact, according to research published in the Journal of the American Medical Association. Here is some information about sudden cardiac arrest. It is a condition in which the heart suddenly and unexpectedly stops beating. It is different from a heart attack, when blood flow to part of the heart is blocked, although cardiac arrest may occur in someone having a heart attack. It is deadly if not treated within minutes. Researchers from Kyushu University Hospital compare the short and long-term outcomes of more than 400,000 adults who experienced sudden cardiac arrest outside of a hospital in Japan between 2005 and 2008. All the participants experienced their cardiac arrest before emergency medical services arrived, were treated on the scene by this personnel after they did arrive, and were subsequently transported to hospital. Of the entire sample, about 15,000 were given epinephrine while resuscitation was being attempted. While those who received epinephrine were more likely than those who did not to have a spontaneous return of their circulation before they arrived at the hospital, longer-term outcomes actually favored those who did not receive epinephrine. These patients were more likely to still be alive 1 month later and more likely to be alive with good neurological and overall functioning. Today's research calls into question the practice of giving cardiac arrest patients intravenous epinephrine before they arrive at the hospital, even if this treatment may help restore circulation sooner. Further studies are needed to confirm these findings, however. For Insider Medicine in Depth, this is Dr. Davin Johnson.